Yeah, hello, sir. Myself from USV Scientific Services. I'll be hosting today's ITM, sir. Fine. So we will be starting. So a very warm welcome to all the respected panelist members and a very warm welcome to today's speaker, Dr. Farad Shabir Momin, sir, on behalf of USV. Myself, Dr. Sheila here from USV Scientific Services. It's a huge privilege in introducing to our today's speaker, Dr. Farad, sir. Sir has worked as a clinical assistant and intensivist at Shushak Hospital. He has also worked as a general secretary in IMA Bhiwandi branch. He has also worked as a vice president in IMA Bhiwandi branch. Sir is a proprietor in Varys Nursing Home, which is a 27-bedded hospital since June 2010, Maharashtra. Sir has a huge clinical experience of almost 14 years, and presently, Sir is a consultant physician and owner at Varys Nursing Home, Bhiwandi. Sir is also working as a consultant at Spectrum and Varys multi-speciality hospital. A very warm
Yeah,
welcome to you,
thank you
sir.
very much. Can everybody see the slides?
Yes, sir, we can see it very nicely.
So this first slide is very important in today's topic, which says all diseases begin in the gut. And gut health is the key to overall health. Now, what I mean to say, I think by our ancestors, by our forefathers, and everyone have been telling us time immemorial, if your gut is healthy, your entire system, including your brain, your body is healthy. And we know it's been so many years since ages and now. And just in recently, we are able to tell it through scientific manner how it is so important. The gut health is important. Now, this today's slide and today's topic is just on that, how to prove it. When your gut is healthy, your entire system is healthy. If your gut is not healthy, probably your entire system can get deranged by different axes. So I think this first slide says it all, and the rest is all theory. And the area is so complex, the mechanism of action of area is so complex, not very well understood, but definitely proven many areas how our gut health is the key to overall health. Now, for that purpose, I really wanted to a very small case presentation of one of the patient who has come to me with severe hyperacidity and all. I will try to present that in the last, because if you don't understand the topic, you will not understand the case, because that case is just a 4 to 5 minute case presentation, and that case says it all. But unless we know the very topic what you're going dwelling into, we'll not understand that case. So with that, I'll just begin with my topic that gut health is the key to oral health. The gut microbiome, that is a good bacteria in our body. It is says the bacterial population has estimated almost 15,000 to 36,000 species. They are present in our body in billions, and they play a very important role in affecting all our system, right from adipose tissue to lung to the brain and to the intestine, through the formation of various positive or negative metabolites, lipopolysaccharides, bile acids, short chain fatty acid, etc. And they affect our system depending upon our gut health. And now this microbiome or this good bacteria, they're acquired initially during birth, and with colonization they start prenatally, and then changing constantly depending upon what kind of food we are eating, the environmental factors, etc. And they play a very role in almost in our entire system. What is the reason to study this microbiota? As I told you, they are affecting our entire system. They provide benefits to its host, including digestion, nutrition, and immunity. And it is said the gene expression is almost 250 to 800 times more than the human cells. Now, what is the reason to study this gut microbiota? Reason is because they play a very important role in our entire system, right from digestion to nutrient production to the immunity. And it is said their gene expression is more than almost 250 to 800 times in the human cells. So it becomes very important how they are affecting our the entire system, and which are the areas they are affecting. It is acting on the protection against the pathogens which is constantly invading our system, synthesis of vitamins, immune system development, promotion of angiogenesis intestinally, promotion of fat storage, by generation of short chain fatty acid. They help in fermentation of dietary fibers and generation of energy, and of course modulation of central nervous system. Now this we will think detail how they're affecting, but the gist is the microbiota of our system is going in every system and affecting either positively or negatively depending upon how we are eating and how our gut health is. So for that, what we called is gut bacterial microbiome axis. That means the connection from the gut bacteria to the system. Now, this gastrointestinal bacterial microbe does not apply and shape only the immunity at its corresponding barrier, but it is also exert powerful effect on the systemic immune response. That is what I'm trying to say here. And for that, we have different axes, the connection between the gut and the vital parts of the body, like the gut lung axis, the gut brain axis, etc. So we'll see in short one by one how it has been affected, how they're interacting with each other, and how it is affecting our body. First is the gut lung axis. This axis is the anatomic communication and complex pathways connecting the microbiota of the gut and the lung, and it supports the existence of the gut lung axis, and it goes through the mesenteric lymphatic system, which is the essential pathway through which the intact bacteria, their fragments, or the metabolites, they may translocate across the intestinal barrier, reach the systemic circulation, and they modulate the immune responses. And because of this, they can interfere with the course of the respiratory diseases either positively or negatively. And this gut microbiota, they closely interact with the mucosal immune system using both pro-inflammatory and regulatory signals through a complex mechanism. And lastly, this innate lymphoid cells, which is involved in the tissue repair, is recruited from the gut to the lung in response to inflammatory signal. So this forms the basis of this gut-lung axis. Here is a chart which shows if we have a healthy body and healthy microbiota, there is no pathogenic colonization, there is decreased bacteriocytes, decrease in the proteobacteria, leading to enhanced immunity. Whereas if there is a dysbiosis, it can lead to increased intestinal permeability, increased formation of harmful metabolites, which can cause intestinal injury, and the increased risk of respiratory tract infection. Now here, with this is happening with dysbiosis, with the use of probiotics, this can be reversed, resulting in boosting of the immune response, boosting of the pro-inflammatory, inflammatory and anti-inflammatory like pathogen clearance and tissue resolution markers, and increase in the positive microbiota restoration, leading to normal gut biodiversity. So this is what is trying to say with the gut-lung axis. There is also called as gut-brain axis. Now this is bidirectional communication between the central and the enteric nervous system, and it affects our cognitive centers of the brain and also the peripheral nervous system and the intestine. And whenever there is a dysbiosis occurs in functional gastrointestinal disorders that are highly associated with mood disorders, which are linked to this gut-brain axis. And how they are bidirectional from the gut microbiota, there is production, expression, and turnover of neurotransmitters like serotonin and GABA, and brain-derived neurotrophic factors, which is happening, protection of intestinal barriers and tight junction integrity, modulation of enteric afferents, and mucosal immune regulation. From the brain to the gut, the response to this gut-brain axis from the brain, there is alteration in the mucus and biofilm production, alteration in the motility, alteration of intestinal permeability, and alteration of immune function. So they are acting with each other. If there is a dysbiosis, the gut responds to the brain acting negatively, and from the brain, the because of the formation of harmful chemicals, they are acting negatively on the gut, and they are working in a circle and affecting each other. This is a chart to show that only, like if there is a dysbiosis resulting in inflammatory formation of cytokines, neuromodulators, etc., they go into the brain, they affect on the psychological and behavioral disorders, cognitive deficits, depression, They're also acting the peripheral nervous system, the afferent, the efferent. They also act the hypopituitary axis. They also act on the neuroendocrine system, and they interact with each other. At the same time, because the brain is affecting, it again acts on the gut, producing more inflammation, and this cycle continues because of dysbiosis. Now, in certain condition, with the use of probiotics, there is regulation of digestive pH, which avoid inflammation and formation of increased BDNF, which prevents cognitive decline and reduces alpha beta plaques. So here also the use of probiotic for a period of time affect positively on the brain and helps in the recovery. Now, gut-liver axis, it is the interplay between the gut bacteria and the liver through vascular mode of the gut microbiome. And common liver diseases like alcoholic liver disease, non-alcoholic fatty liver disease, liver cirrhosis, or even hepatocellular carcinoma, they are associated with changes in the bacterial gut microbiome. What is happening because of the dysbiosis? There is increased gut permeability, which allow translocation of microbes and microbial product, leading to all this common pattern. The immune receptor of the cell, like Kupffer cells, etc., they identify this pattern and they lead to activation of inflammation cascade, causing fibrosis and cirrhosis in the course. This is the diagrammatic representation of the same thing. What is happening? The gut-related damage. They are increasing the all these toxins. The cells of the liver, all these cells, the sinusoidal cell, the stellate cell, etc., they react negatively because of this gut dysbiosis, leading to fibrosis and cirrhosis, leading to damage to the liver. And if we are giving probiotics in such conditions, the condition is reversible. What they are doing, they are helping in the formation of good microbiome in the gut, increase in the metabolites, decrease in the endotoxin, and they help in the gut barrier function, decrease in the endotoxin, leading to reduction in hepatitis, reduction in the brain liver damage, and pro-inflammatory cytokines, leading to a healthy liver formation. So even probiotics is playing a very important role in such conditions if the condition is actually reversible in the mild to moderate cases. There is also association of gut, brain, and skin axis. What they have found, there is a possible role of M. torsine acne pathophysiology, the interaction between the uh, uh, mTOR, that is tissue of rifamycin, which is a receptor, and gut microbiota, which serve as a mechanism by which the intestinal flora aggravates the acne. We'll see how it does. And the mechanism remains the same. There is dysbiosis, which causes the intestinal barrier disruption, formation of gut microbiota and the metabolites entering the bloodstream, they accumulate in the skin, and they disturb the skin equilibrium. Here again is the chart which again showing there is an alteration in the gut microbiota, which is again aggravated by stress, leading to formation of metabolites, which alter the skin mucosa, leading to the acne formation. All this kind of high glucose, high fatty foods, they very negatively affect our gut microbiome, leading to the chain causing the formation of acne and other skin infection in a person. Now, this can be reversed with the use of probiotic because they reduce the interferon, they reduce itching, they decrease the itching, reduce pigmentation, and help in the recovery of acne. The thyroid gut axis, it has been observed there is a very high prevalence of thyroid and gut related diseases. Dysbiosis, bacterial overgrowth, increasing intestinal permeability, and a shift to pro-inflammatory cells are the factors of microbial impact on the thyroid gland. and it is observed these biases can directly impact thyroid hormone level through its own deiodinase activity and inhibit the TSH. And this gut microbiota, if it is in a healthy state, they also influence the absorption of minerals that are important to thyroid, for example, zinc, iodine, selenium, and iron. So in hypothyroidism and hyperthyroidism, lactobacilli and bifidobacteriaceae are often reduced. Here is a chart which showing the thyroid gut axis and role of probiotics. It is observed microbes function as a reservoir for T3 and able to prevent fluctuating thyroid hormone and thus may be able to reduce the need for T4 supplementation. And probiotics for a short period of time could constitute an adjuvant therapy for thyroid diseases. Like if there is a dysbiosis, in condition of autoimmune thyroid disorders, there is a positive effect of probiotics because they regulate the immune system, help in the absorption of the micronutrients, as I told you, selenium and all, and help in the restoration of normal TSH and normal T3 and T4. The gut kidney axis, there is also bacterial translocation of the gut to extraintestinal sites like kidney in dysbiosis, bacterial overgrowth, and low host immune defense system. And the gut microbiota produces many uremic solutes and toxins during chronic kidney diseases, and they worsen the or they may progress the condition of the kidney to chronic kidney disease. When barrier is ruptured from this leaky gut, the immune cells are activated. They infiltrate the kidney and induce pro-inflammatory and anti-inflammatory function as well as regulatory signal to modulate the neutrophil response, thereby damaging the kidney and reducing the GFR. This dysbiosis leads to decrease in beneficial microbiota like bifidobacterium and lactobacillus. Reduction in short-chain fatty acid and bile acid level is observed. Here is a chart. As we have seen, because of this bacterial translocation and all in dysbiosis, there is a uremic toxin formation and then there is a kidney dysfunction. Here, as I told you in the previous slide, the liver is also damaged because of the gut dysbiosis. Now, this chart is very, very important. It shows the mechanism of how this probiotic acting, how positively it can affect our kidneys and the liver at one go. What they are doing, they improve the level of uremic toxin in the blood and restore the gut microbial balance. They enhance epithelial intestinal integrity, thereby impede pathogen entry and adhesion in the epithelial cells. They also maintain the glucose homeostasis and reduce inflammation, hepatic steatosis due to modulation of bile acid, short chain fatty acid, and lipopolysaccharide production. And several lactobacillus they decrease the gut pH and thereby they prevent the multiplication of harmful bacterial pathogen. All this which is present in a probiotic like lactobacillus and prebacteriac when given, they increase intestinal colonization and adherence, thereby decreasing the gut permeability because the more the gut permeability is there, the more is the release of this metabolite into the system affecting our vital organs. They increase oligosaccharide degradation, thereby the increasing the energy source formation of ATP, etc. They increase bacteriocins, which kills the bacteria and decrease enterobacteriaceae. They increase short-chain fatty acids, thereby reducing the inflammation. They increase urease, uricase, and activity and amine degradation, thereby reduction in UTUria and oxidative stress. And of course, they increase the oxalate degradation, thereby decreasing the stone formation. All this affect positively in reducing uric environment, reduction of cardiovascular disease, gastrointestinal discomfort, improve the quality of life, and delay the end-stage renal disease progression. The microbiome of the genitourinary tract is very well known. We all know the lactic acid indirectly through its anti-inflammatory effect impact on the vaginal epithelial cells. They reduce production of pro-inflammatory cytokines and increase production of the interleukin-1 receptor antagonists. And this lactobacillus bacilli dominated vaginal microbiome, they protect against urogenital infection such as urinary tract infection or STDs pathogen like chlamydia or human or HIV or HSV or herpes simplex virus because of the lactic acid bacillus. And this production of this antimicrobial compounds as hydrogen peroxide, which is and bacteriocin and lactic acid serve as a first effective line of defense, and they establish a low vaginal pH, and they prevent in developing a hostile environment and conducive environment for the invading bacteria. They prevent they because of the reduction in pH, they make a hostile environment for these harmful bacteria and thereby their multiplication in the vagina. This is just a slide which shows how our gut microbiome affects in all the system, as I mentioned in the previous slide, whether it's the gut brain axis, the gut skin axis, the gut bone axis, the adipose tissue, the liver, the skin, the kidneys, etc. Everywhere it is affecting our system. So maintaining a good health is very, very important to prevent us from getting the diseases and progressing towards the health. It has been shown here. Any altered pH, excessive protein consumption, sugar intake, saturated fatty acid, or taking proton pump inhibitors. My case was one of the patient who was taking these PPIs, and thereby what is happening with this? It can reduce the short chain fatty acid, increase cardiovascular risk, gut inflammation, cognitive decline, insulin resistance. All this will be get negatively affected. And if you are maintaining a good dietary intake like high fiber diet, moderate protein, and mild carbohydrate diet, and intermittent use of probiotic as and when required, because sometime our immunity goes down, sometime our health is affected. During that period of time, uh, temporary use of probiotic for a period of 2 weeks to 2 months if taken can restore our gut microbiota, thereby preventing all these diseases and taking us to our healthy body and prevent affection of our vital organs. Now, this is the last few slides which says many studies are being conducted recently on the interaction between drug use and the microbial system. And the most important is the proton pump inhibitors, which have been long used globally. And it is one of the most important type of prescription known to inhibit gastric acid secretion. That is the reason we have to be very important to study this, what is happening when we are giving the patient for proton pump inhibitors for a very long time. Now, these proton pump inhibitors like omeprazole or pantoprazole or lansoprazole, they are used in many diseases, like for example in GRD, peptic ulcer or steroid-induced gastrointestinal region, for prevention and control of Helicobacter pylori infection, and sometimes eosinophilic esophagitis. What they are doing, they bind to the hydrogen potassium ATPase antiporter pumps of gastric parietal cells, and they preventing hydrogenine from being released into the stomach cavity, and they increase the gastric pH. And because of this, the gut microbiome reportedly can be explained the combination. Now, what is happening? Because when you're giving the PPI, the two action occurs. First of all, the direct inhibition of some commensal gut bacteria, such as Ruminococcus aureus species, and they get inhibited because of the increased pH, and indirect stimulation of the growth of some typical oral bacteria, which is mediated by the increase in the gastrointestinal. So, what is doing? PPI is doing, they are inhibiting some good bacteria, and they are helping promoting the bacterial overgrowth in our gut, which is not good for our system. Now, whenever we are using this PPI for a long period of time, it impacts not only our survival, it induces migration of bacteria along the gastrointestinal tract and the risk of gut dysbiosis because of bacterial overgrowth and because of dysbiosis. So long-term PPI use is very much harmful. And because of this, one of the patient who has come to my clinic was using PPI and how we treated. That was my case. Now, since we have understood these slides, we can go ahead with the case and explain to you in next 5 minutes. So the topic is probiotic in PPI associated gut disturbances. Uh, he was a young man and a chief complaint of burping, bloating, flatulence, abdominal pain, and non-cardiac. All typical feature he has whenever he used to have food and all. He start bloating, hyperacidity, flatulence, and he was very much stressed out. He was not able to sleep also because of this. All was playing interplay. He has an unhealthy diet and emotional and spicy food because in today's scenario, the food timing is very much disturbed. People are eating any time of the day. In the middle of the night, they're eating all spicy food. All this low fiber diet, fatty foods can contain a lot of trans change fatty acids. All these pizzas and burger they are eating, and all this causing a lot of hyperacidity to this person, and this is causing a lot of emotional stress ki why I'm having all this thing and I'm not able to eat and all this thing. That is adding to the stress to the person. At the same time, he had some personal stressful history which is again giving rise to hyperacidity. So all was playing interplay, and the person was taking intermittently, sometime for a prolonged period of time, antacids, PPIs, etc., from the chemist, sometime from the local doctors. Uh, Once in a while, he has even come to me and asked him to follow, but he never came up. But when finally he came, I was able to see him properly, take his history in detail. His vitals were normal, weight was okay, blood pressure was normal, BMI was okay. So overall, there was no issue as such. Finally, I diagnosed me while he's having a gastroesophageal reflux disease because of the lifestyle pattern and all. And the patient was treated with, I asked him strictly not to take any kind of PPIs, any kind of antacids and all because they have been long taken and they really inhibit the gastric acid pH. I told him he was very adamant of that. One day he doesn't take, he get hyperacidity or all. I counseled him, you have to relax, don't take. Gave him probiotic like Vibec DAP combination of which has typical combination of lactic acid bacillus streptococcus in high doses. Along with that, I also gave him some anti-anxiety medicine for a short period of time and counseled him for a proper diet. Like he asked him to take not to skip any of the meal. You have to take the meal on proper timing. You don't have to keep on taking any time of the day, whenever he wants on his whims and fancies. The timing was fixed. What time breakfast, what time lunch, what time dinner you have to take. Ask him not to avoid stress and NSAIDs. I gave him a small dose of paroxetine 12.5 milligram. Then lifestyle modification to elevate the head on the bed while sleeping. Very low boiled food for 2 to 3 weeks. Lots of water, around 3.5 to 4 liter, green leafy vegetables and all. As I asked him not to take many fruit juices and even fruits, lot of fructose, fruits and all. I asked him not to take too many fruits and all. Avoid chocolate, coffee, any kind of alcoholic drinks, citrus fruits and juices of tomato and etc. And not increase the amount of fiber and decrease the amount of carb. You know, a lot of carb sometimes people take, that also causes a lot of acid formation and hyperacidity because of fermentation. And I asked him to make a diary over 2 to 3 weeks and ask him to follow up. When he follow up recently, there was a lot of improvement. There was reduction in the abdominal pain, bloating, nausea, and flatulence. reduction in nausea, acid regurgitation, and abnormal bowel movement, and reduction in indigestion and heartburn. He was tremendously happy for the very first time. He was looking, elated and happy. His stress face was out. He was feeling much better. Uh, because I counseled him, you have to be very strict, and whatever I say, everything you have to follow, otherwise you will not be cured. So what is happening here with the probiotics here? Now I can read this slide because now I have told the entire what is probiotic is doing in our system. With this one slide, now you can understand which you could not have understood in my previous if I presented this case. What is happening? This probiotic helps in maintaining the normal balance of the good bacteria in the intestine, and it is also known to improve immunity, as I said, by ensuring the proper functioning of the gut health. And it modulates the immune response and antagonistic activity towards potential pathogen through production of lactic acid and secretion of short chain fatty acids from the probiotics, which result in a decrease in the luminal pH and expression of bactericidal proteins. Now I think with this slide you will understand what I'm trying to say. So probiotics in PPI associated with gut disturbances, what is happening? Modulation of GI immunity through alteration in inflammatory cytokine profiles, potent inhibition of pathogenic bacterial adhesion, modification of the bacterial flora, enhancement of gut epithelial barrier function, reduction of visceral hypersensitivity and stress response. All these things are done through probiotics and restoring our gut immunity and overall our health. Follow up after 1 month with Vyback DS treatment, resolved clinical complaint associated with gut disturbance. He was much better. And the synergistic effect of the right dose of lactobacillus and streptococcus faecalis improved the overall clinical scenario. And the patient reported excellent efficacy and tolerability. Now, what is happening? In the overview, the chief complaint: burping, bloating, flatulence, abdominal pain, and non-cardiac chest pain, GRD. Gave him Vyback DS for 1 month. There was a lot of reduction in abdominal pain, bloating, nausea, and flatulence. Reduction in acid regurgitation and abdominal bowel movement. Reduction in indigestion and heartburn. And patient compliance with very good efficacy and excellent tolerability. See, here the patient compliance is very, very important because he has to follow his routine dietary schedule slowly. I'll be able to shift the patient to normal but not spicy food. And of course, the composition of food and all what we have told is also very, very important. Slowly, what is probiotic is doing is improve the whole gut transit time, stool frequency, even stool consistency. So it is affecting everywhere because with probiotic, you are also giving a lot of diet restriction to the patient, diet modification. What we are telling, diet is actually the normal diet which we should be taking now because of today's lifestyle. People are not taking, and they are landing up in this kind of scenario day in and out. And every day one patient you get in your OPD who are this kind of patient who come to your clinic. I think I've made my point clear. Thank you very much.